country western star. We're putting him on stage.
Anyway, my kids, by the way, the other part of this hat, which you'll appreciate,
genuine?
my son, who moved to Austin, brought it back to me and gave it to my kids for Father's Day.
Okay.
Now, if they see a picture of me in that,
All right, go ahead, Senator, try that on, Senator.
That's great.
I only obey Jimmy.
Oh, thank you, Bill. When you were Attorney General, I obeyed your orders.
Here's Susan Beisowitz.
Okay. And now live in person.
At the direction of the Lieutenant Governor, let me come up to the microphone and thank everyone for being here. I didn't do the tour, but I've been in and have been in constant awe of this facility, putting aside the personnel, the hard work, the vision that had to precede it. It is just like, I mean, we talk in maybe in government or whatever about buildings. You build stuff, bricks and mortar, infrastructure, but you don't do it with imagination and design the way this is. That's just a facility, and that's just a facility. And then you get the vision and the commitment of who become not just friends in the city of Bridgeport, but major supporters of the things that are most important from private sector who don't just talk about doing stuff, which we get too much of, right, Gov? Instead of everybody telling us they're going to do this, they're going to do that, and they're going to bring jobs in and do something. But just do it and say, just do me a favor, public sector, get out of the way. Just let us do what will be good through what's going to be phenomenal. So I want to thank everyone. Governor, you for being here. And the partnerships I'm talking about, this isn't just talk. You go back in the coldest of days. Where's Chaz and AJ? You go back to the coldest days, right? And with seeing the city council wanting to help homeless individuals with blankets and coats and backpacks. And all of a sudden, boom, you put star power behind it. Predominantly Jimmy, right? As soon as Jimmy's name went in, donations went. They provided hundreds, I don't know, maybe more than hundreds of warmth to individuals. But for God's grace, go I, are homeless and challenged in life. And so there's something really positive about that. And then today with the partnership on vaccines, not just making this the premier entertainment venue in the ... We'll let that sentence get finished as people see it open. I think it's a big, broad breath. But partnering on the vaccines, understanding there's still a challenge out there. People need to be safe, make sure that their families are safe, their loved ones are safe, going back to school are safe, and this is a major step in that way. It's just fun, too. I mean, I could walk in with a cowboy hat, razz, we could all razz about who's going to be our favorite that we want to see here. So without further ado, Madam Governor, I will present the microphone to you. Welcome you as well to the city of Bridgeport. Let's give them all a round of applause for all they're doing.
Mayor, thank you so much, and you are wearing the best boots in the house. Those are awesome. So it is great to be in Bridgeport on the first weekend of summer for a really important event. We know that Connecticut is the place to be in the summer, and we're having thousands of people come to our state to visit our entertainment venues, to visit our zoos, our museums, and Connecticut is coming back, and it's coming back because of all the work that we've been doing to keep people safe by getting them vaccinated. And we've been leading the way. But in order to crush COVID, we really have to focus on the youngest people in our state. It's the 18 to 39-year-old age group that is lagging in vaccinations. We need to get 41% of those folks in that age group who haven't been vaccinated. So we're here in the cultural hub, not just of Connecticut, but in the entire Northeast. Look at this beautiful entertainment venue. And this is going to be a place where lucky winners of the contests and the incentives that we are announcing today can come to listen to some great music, see some great entertainment. And so we're here with our partners so that we can rock the shot. We want to get young people vaccinated so they can enjoy the summer, keep their families safe. And I'll tell you that the 3 shots that are available are effective, they're safe, and they're going to be the key to the continuing reopening of Connecticut. So we have some incredible speakers here, and we're going to start with our great Deputy Commissioner of Public Health, Heather Aaron. Deputy Commissioner, come on up.
Thank you. Good morning, everyone. I'm Heather Aaron. I'm the Deputy Commissioner for the Department of Public Health. I want to thank our Lieutenant Governor, our Governor, and the Mayor Ganem, and all the distinguished guests here today. Thank you so much for having us here for a few moments. As the Governor always says, nobody knew what public health was before the pandemic, so we got a couple of minutes to come talk to you. So on behalf of the Connecticut Department of Public Health, I want to thank everyone for stepping up today to be part of launching the Rock the Shot campaign. Shots in this effort is huge in bringing all of our residents together. We have been leading the way. We started with the age base, and it definitely was extremely successful that we started that way. We took the death rate down precipitously. We have not seen anything related to COVID deaths in a couple of weeks, which is amazing. And so the right thing was done when that decision was made to go that way. Now we're here and we have our children, basically at my age, they're all children, anybody 18 to 39. So we need to get the rest of the population vaccinated. And why is that important? We cannot afford to go back to where we came from. And we should not forget, it was only a year ago that we were in the height of this issue. So it's not gone, it's laying, lurking around, and it can come back. So what we need to do is rock the shot. We need to make sure that we get all our kids vaccinated, influence them, give them what appeals to them, and get this done. So we think that this is going to be a great way to kick off the summer. We've been leaders in the country. We are vaccinated. We've put out more than 4 million shots. That means we have over 2 million people that have been vaccinated completely, and that is a credit to our governor and his staff. So we're here today to appeal to you, to let you know, we don't want to be downers, but to let you know it's not gone. We have variances out there. The Delta variant is now the predominant variant, and it's lurking around. So please, thank you, and keep rocking the shot. Thank you so much.
There you go. Thank you. Thank you so much, Deputy Commissioner, and we are laser focused on trying to get the 41% of young people who are not vaccinated, and here to talk about what's being done in the Bridgeport area to do that is Dr. Stephen Velazas of St. Vincent's Hospital. Dr. Velazas.
Hello, everyone. It's really amazing to be here today at Hartford Healthcare Amphitheater. We're celebrating the tremendous progress that we've done as a community and as a state to get here today. Here without masks, here on the eve of opening up concerts. It's really a wonderful time. But it's important to remember what the pandemic did to us and never to forget that. Schools closed, people were isolated from friends and from families. It kept us from church. Those first few months were difficult ones. The hospitals emptied out, and then slowly they filled in with so many severely ill patients. So many older patients with lots of medical problems, but also so many young patients, people who looked like all of us. They were there, trouble breathing, and severely ill. I'm so proud of the work that was done by my colleagues at St. Vincent's and Hartford Healthcare. We rallied to care for our community. Everyone became a COVID specialist here. And they say our community. I grew up in Connecticut. I've been working at St. Vincent's for the last 15 years. Our staff all live here. This is the community that we're here to take care of. But as we cared for those who were critically ill, we all waited for the vaccine. We all waited for a way out of this. And I remember those days when we opened up our vaccination clinic at St. Vincent's, and hundreds of people came to get vaccinated. And I would walk up there We would go there to make sure people weren't having allergic reactions, to make sure that everyone tolerated the shot well, and people were happy. The relief on their faces when they were there, when they were getting vaccinated, when they knew that they can get back to life after that. But HHC realized that we needed to do more. We needed to take the vaccine out of the hospital, and so Hartford Healthcare opened up megacenters throughout the state. Here locally, we had the vaccination clinic at Central High School, and we partnered with Sacred Heart. And Hartford Healthcare has vaccinated nearly 500,000 people in the state of Connecticut. That's the most vaccines of any other system in the state. But our work is still not done. There are disparities in vaccination rates. There are towns in the state that have rates of 75%, and those communities are very, very safe. But yet some of our cities have rates of less than 50%. And so we really need to focus on getting people vaccinated so that our communities can all be safe. We can't leave anyone behind in this. You know, viruses do what viruses do. They mutate. And as you've heard, we've got the Delta variant that's out there now that's becoming the prominent strain. But for them to mutate, they need people to infect. If we all get vaccinated, the viruses have nowhere to live, they have nowhere to mutate, and we can put an end to this. I think it's time to enjoy this beautiful summer. We've all done a lot of work and a concerted effort to get vaccinated, but let's finish the job. Let's end the pandemic once and for all, and let's get back to life the way we remember it. Thank you.
Thank you so much. Thank you so much, Dr. Velazas. It's now my pleasure to introduce Patrick Sharmell. He's the CEO of Griffin Hospital, and he's been an incredible partner both in terms of helping us expand our testing and our vaccination infrastructure. Patrick.
Thank you, Lieutenant Governor. And it's been a great partnership with the state of Connecticut under the leadership of the governor and the lieutenant governor and Deputy Commissioner Aaron, who actually orchestrated the testing program in nursing homes across the state to protect the most vulnerable in our community, and also the mobile vaccination program that I'm here to talk about today. As the mass vaccination sites that Dr. referenced begin to close this month and into next month, we're going to be deploying, and we've already done this, 35 mobile vaccination teams that are going in communities throughout the state to try and get to those individuals that have yet to be vaccinated and may in fact be hesitant to be vaccinated. We're trying to overcome whatever barriers they have to vaccination. We're here today to talk a little bit about the younger population. You heard some of the rates, but I want to give you the number. There are 594,000 individuals in Connecticut under the age of 34 that haven't been vaccinated yet. And we have to speak to that population directly. Yes, we've done already 1,000 mobile vaccination clinics. We've done 67 of them here in the city of Bridgeport, and we're getting to populations. We're getting to those that are vulnerable. But now, in addition to continuing our focus there, we've got to focus on the younger population. So offering incentives like concert tickets is wonderful, and we're going to be doing that so they can enjoy the summer. They can enjoy the freedom of being vaccinated. But we also have to address these lingering concerns. You know, the research shows that most of the communication that we've done about the benefits of vaccination really hasn't been targeted at the young. And it hasn't been using communication vehicles that they're familiar with. For instance, none of us have done a TikTok video yet to talk about the benefits of vaccination. So I'm inviting the governor and DC Aaron to join me in a TikTok video today. I've seen the governor dance. And I know it'll,
And play the piano.
and I know it'll go viral. You know, we need to be using Instagram, but we also need to be addressing their concerns. They have legitimate concerns. Young women of childbearing age are concerned about the impact on fertility. Unfortunately, some anti-vaccination zealots in Europe wrote a letter to the equivalent of the FDA months ago, making some tie between the spike protein and the vaccine that addresses the spike protein in COVID-19 and a different protein that actually is involved in placenta formation. Somehow, that became sort of the conventional wisdom, and now young women are concerned that it affects their fertility. It was never true. It's not true. There are men out there, young men, concerned about their fertility, and somehow that the vaccine affects sperm production. I bet you didn't think you were going to see the mayor in a cowboy hat and me talk about sperm today, but it's really important, right? The only connection is when you get vaccinated, you get a low-grade fever for 1 day. And that low-grade fever can temporarily reduce sperm production. But by the way, if you get COVID-19, you get a fever for 10 to 14 days. It kills a lot more sperm, all right? These are the things that are a little uncomfortable to talk about, but we need to talk about if we're going to get to this population. Almost 700,000 young people haven't been vaccinated. And by the way, the outbreaks that we've seen in the Midwest and in Canada and Europe have actually started in that population because there's reservoirs, the doctor said, of unvaccinated individuals. And now we have variants that spread more quickly, and they're great hosts. So we're putting the entire population in jeopardy because we're not making a connection with that younger population. So today is part of that. What we're doing today and talking about these incentives is great, but it's got to be part of a comprehensive effort. And we're committed to that, and everybody behind me today is committed to it. So hopefully you'll help us get that word out. Thank you.
Patrick, Sharmell, thank you so much. And now I'd like to invite up our host, Howard Saffin, principal of Hartford Healthcare Amphitheater. Thank you for hosting us today.
Good afternoon. Thank you, Governor, Lieutenant Governor, Senator, and Mayor. It's quite an honor to be here and to look out in front of you at this magnificent facility. 8 years ago, Jim Koplik and I had a lunch, and at that lunch, Jimmy said to me, the future of concerts in the United States is boutique amphitheaters and festivals. Here we stand today, and his words were absolutely accurate. So when I grew up, I used to watch The Wizard of Oz, and that was my favorite movie. So if you take this amphitheater and think about The Wizard of Oz, Jimmy and I descended into the yellow brick road years and years ago, and our path encountered a lot of different things. We encountered a building that had a lot of challenges. We encountered an opening date last year of, July 29th, that we were going to open up this facility. But more importantly, what we encountered was a pandemic that nobody ever envisioned. And through the leadership of our governor, we have managed to do things that no other state throughout this United States has done. The leadership that he has shown is something that I personally am proud of and happy to say that I'm a Connecticut resident. Patrick, I got my vaccination at Griffin Hospital, and I want to thank you guys. It was very, very interesting. We did a press conference here to announce our naming rights. And Jeff Flax, the CEO of Hartford Healthcare, turns to me and he says, and this is in March, he says to me, Howard, the positivity rate come June 1 will be less than 1%. And I called Jeff on June 1. I said, how the hell did you understand and know this? And his response was, I have really smart people working for me at Hartford Healthcare. So I wish Jeff could be here to give him the tribute. But as we go along our journey, Jimmy and I are coming out of Oz. We're coming back to Kansas. And we open up July 28th with an amazing show. Thank you, Jimmy, so much. With REO Speedwagon and Styx. And we are so, well, that's Rowena White, who absolutely is a big fan. Yeah. And we are so,
I don't know about this.
we are so happy and proud to be part of the city of Bridgeport, to be part of the state of Connecticut, and to have our leader, the governor, who's gotten us through this absolutely horrific experience over the past 15 months. So as the Hartford Healthcare Amphitheater, we are proud to be part of Rock the Shot. We believe that it is so important to get to the youth of the Connecticut, and Jimmy has absolutely created, Jimmy and his son Jeremy Koplik have created a 25 concert schedule that should interest 18 to 35-year-olds, and hopefully we can turn the corner a little bit, and thank you very much for coming.
Howard, thanks so much for having us in this beautiful amphitheater to get the message out to the young people of our state and to the people of our state, because we had 2.1 million people fully vaccinated, 2.4 million people have had at least one shot, but we are a state of almost 3.6 million people, with more coming every day, so we still have a lot of work to do. And helping us to get the message out is the dynamic duo of Chaz and AJ of 99.1 PLR, and I'm going to have them come up together. Come on.
We have a prop for the governor. The governor is having a week he hasn't had since college. Weed on Tuesday, concerts on Friday. So congratulations, Governor. This is terrific. I'm Chaz from Chaz and AJ in the Morning, 99.1 PLR and 95.9 The Fox. It's Norwalk, Stanford on the Fox, and New Haven for WPLR. 15 months ago, no one knew where the bottom was on this, right? We couldn't find toilet paper. By the way, I have a lot now if anyone needs any. Still looking. That person. But here we are, and I would not have guessed 15 months from now we'd be talking about concerts and we're all getting together. And the governor has come on repeatedly and given all the credit to the Connecticut residents, the masks, the social distancing. But I think we should take a second to thank the governor and his staff for leading us through this beautiful job. But now the governor is once again asking the people of Connecticut to step up and finish this job. We're in the last 15 seconds of the game here, and it's time to do it. And I think that we all know that if you're not going to get a vaccine, a pair of concert tickets won't get you there. But if you're in that group that you thought, you know, my friends weren't really that sick, so I don't have to do it, or I was going to do it, but then the numbers got good, here's a deal for you. You could be part of the premiere season of one of the world's greatest concert venues by just getting a vaccine and protecting people. So we hope you rock the shot. Thank you for having us. Appreciate it. Thank you, Governor. Thank you.
Thank you so much, Chaz and AJ. I'd now like to bring up Representative Antonio Felipe.
Good morning. I want to first thank Howard for bringing us to this incredible venue. If anybody has seen it light up our night sky over the last couple of weeks, it's breathtaking. And I can't wait until we all come together and we're here rocking out. But before we do that, we need to rock the shot. And we need to do it by coming together without fear or hesitancy or uninhibited by any of those things. And even me as a vaccinated man, I still walk around with a mask, just in case somebody has that fear or hesitancy around me. Because I know that it's going to take a lot. It's going to take for us to get our young people educated, for them to visit our DPH website, talk to some of our great healthcare professionals who I am glad can join us today, and work with us, Lieutenant Governor, and the Governor, to really rock the shot so that we can come back and be together once again. Thank you.
So Howard referenced the yellow brick road. So I'd like to bring up someone who has been so helpful and generous in opening up some of his venues and being an incredible resource for us as we needed large spaces to get people vaccinated. Our partner, Jim Koplik.
Jimmy. Well, first of all, it's nice to step up and not have to have the table washed and put the mask down and put the mask back on again. It's first time. Secondly, I am a St. Vincent's vaccination alumnus, so thank you very much. I appreciate that. And I appreciate Hartford Healthcare. We did open up Oakdale, as the Lieutenant Governor mentioned, and the Xfinity Center in Hartford. And we gave out over 2,000 shots a day during the time that we were open, which was great. I think we ended up doing something like 30 or 40,000 shots over the two venues. And as I tell everybody, I've been in the concert business for 52 years, but I was in the vaccination business for 1 year. And I'm finally glad that we're getting near the end. We're very, very proud of what the governor did. The governor actually made me look really good to my company because Connecticut opened up so early compared to most other states, and I got the credit for it, so thank you very much. So I appreciate that. But then they put me in charge of New York, and I kind of screwed that up because we didn't have the same governor, but that's a different story. Something I probably shouldn't have said just then. I'm known for that, I'm afraid, so I should get out of here real quick. But I do really appreciate everything the governor did. We were able to open up early. He gave us guidance. Hartford Healthcare was very, very helpful in opening up our venues. And the promotion we're starting this week is going to be one where we're aiming towards the 18 to 34-year-olds that like country music and hip-hop music. We'll be giving out tickets to people who are getting vaccinated or people that have been vaccinated. Governor and I have had long talks about it. It's not fair for people who are up front getting vaccinated not to be eligible to win these tickets. So it's going to be either vaccinated people or people who are going to get vaccinated that will win these tickets. Mostly hip-hop and country. We know that's what young people like. I don't know a Lil Durk from an NF, but I knew a Leonard Skinner from a Marshall Tucker band. That much I do know. So I just want to thank everybody for being here in this promotion. We're very, very proud to be part of. Thank you.
Excellent. Now I'd like to introduce Aidenav. She is the president of the Bridgeport City Council. Heidi.
Thank you, everyone. Good morning, everyone. I just want to mention that right now, if you're interested in getting a shot, you can go on down to Seaside Park. We have our vaccination clinic happening from 9 a.m. Till 6 p.m. We have one right behind our City Hall building, which is running for the next 3 days as well, from 10 to 2, so our residents can get vaccinated. I say that because it's about accessibility, and Griffin Health and State DPH, along with the governor and DC Heron and Dave Reyes, have made that possible to ensure that we are reaching those in those hard-to-reach communities. And speaking to that, the importance of ensuring that we get our parents and our children vaccinated and our youth. The only thing I can say is that we do have a lot of work to do to engage those youth, to engage those young people under 35, to make sure that they're vaccinated. So with Rock the Shot, I'm kind of excited. I am working on a few initiatives along with State DPH and Griffin Hospital to ensure that we get this messaging out there. Just as Representative Felipe said, we want to get back to normalcy, but it's going to take all of us together. En juntos podemos, so we just have to make sure everybody gets that shot, and let's rock out this summer. Thank you.
Excellent. Thank you, Heidi. It's now my pleasure to bring up our great governor, Ned Lamont.
With his guitar. Look, I was a concert kid, so I could tell you that in the Fillmore East, in the Garden, and Howard, this place is the best. I love this amphitheater. It's incredible. Right here in Bridgeport, right here accessible to everybody. Jimmy's got the most amazing collection of concerts going to be coming up starting this year, and then next year they will knock your socks off. It is just incredible. They're going to come far and wide. Here in Infinity, I think, for the promotion as well. I love it. This guy's a living legend. You know, he was on a first-name basis with Jimmy and Janice. You ought to just talk to this guy. It's pretty good. I was thrilled. Chaz, I love the guitar, man, but it could be worth more than $99, and I think Hazniokas is going to crush me if I keep this thing. Let me just say, I look forward to coming here. You guys should look forward to coming here. And as you heard, it's also a serious moment. I mean, we're working our hearts out to make sure people continue to get vaccinated. And one of the incentives we have now is what we call Summers on Us. It follows on Drinks on Us, very original. And you go there, and that's one of the things that Jimmy did and said, here's what we're going to do. We're not just going to get you tickets if you get vaccinated to some of the best events in the country happening right here starting this summer. We're going to get you the best seats in the house because you deserve it. The best seats in the House. And to take advantage of that. And for any of you who are thinking of doing other type events where you may want the Griffin Hospital mobile van to be there and so people can get vaccinated, you want some incentives, go to ct.gov. Go to Summers on Us, and we'll put together amazing incentive programs that help people do the right thing. And as you heard from the docs here, we've done really well, as a state. Really some of the highest vaccination rates and lowest infection rates in the country, and that's why we're able to, get back to our lives. But we're not out of the woods. And I look around the country, that's around the world for the crystal ball, and I see flare-ups of the Delta variant in places like Britain and places like Israel. These are places that have a high level of vaccination, and yet it is so highly contagious that it's sweeping through that younger population, much less likely to be vaccinated. So that's, reason number 34 that I think this promotion is fun. It shows we got our life back. It shows that we're back on our game. It shows that it's right here in Bridgeport, but also shows you we can't do any of this stuff unless young people continue to get vaccinated. And Chaz and AJ have just been amazing in terms of promoting. We have a lot of fun talking about music, talking about concerts, and you've been invaluable talking to your audience about the importance of people getting vaccinated. So we look forward to doing that a lot. Thanks, everybody.
So we would not be at a 67% fully vaccinated rate without our federal partners. And I also, since I have the opportunity, want to say thank you to our fairy godfather of federal funding, Senator Blumenthal, who's going to say a few words.
Just remember that, fairy godfather. The last time I took a music quiz, I think it was actually this week, from Chaz and AJ, I failed utterly. So I clearly got to spend more time with Howard and Jimmy. By the way, thank you for this absolutely spectacular facility. We think of it in terms of concerts, but I was here to speak to the University of New Haven graduating class this year. Thousands of people were here. They were able to have that graduation in person because of this facility, so thank you so much. The nation is looking to Connecticut, and it has looked to Connecticut from the start of this pandemic for smart, strategic, courageous leadership, and that's what we've seen from Governor Lamont and his team. We've seen it also from our hospitals and healthcare providers. They have come together in a way that is absolutely miraculous. So my thanks to all the frontline healthcare workers. I hope you take that message back, that they've really been the heroes here, and they continue to be the heroes. But the reason that the nation is looking to Connecticut is that we've done it the right way. And today's just another example of it. We're doing it the right way. We are leaving nothing to chance. That 18 to 34 population, 594,000, is huge. We can't conquer this pandemic. We literally will fail unless we reach those 594,000 people and the rest of our population who are hesitant, resistant, call it whatever you want, but they need to be vaccinated to stop the Delta variant, to stop the mutating virus, to stop the threat. As long as this virus is spreading, it is threatening everyone. And we could be back to those dark times unless every one of us does the right thing. In other parts of the country, they are looking to Connecticut, and we need to lead by our example. And the problems in other parts of the nation are even worse in terms of numbers of people and percentages of population. But the best way to make us all safe is for everyone to be safe, and that's why today is so important. So rocking the shock is more than just a fancy name. It is what we need to do to rock the shot and to make sure that everybody does the right thing. So thanks again to the governor, and thanks everyone for being here.
Great. Thank you, Senator, and we're so grateful to all our media partners for being here. So we have all these distinguished, smart people to answer questions.
Can we get a quick rundown of how this is actually going to work? I assume you're going to have mobile vans at these concert venues to offer vaccinations, and then how will the inducements work for people to get a chance on tickets? I assume not everybody who gets a vaccination is going to get a free seat, but so if you guys can just run that down, it'll be helpful.
Right, as I mentioned, we're operating up to 35 mobile vaccination clinics a day throughout the state. So individuals that present at those mobile vaccination clinics will be eligible for these incentives, right? In addition, we could talk to Jimmy about actually having mobile vaccination clinics at the concerts themselves. So we've been at beaches, we've been at museums, we've been at community centers. So anywhere where people congregate, we're gonna host a mobile vaccination clinic.
Okay, but there's no firm plans yet to...
No, there are.
Yeah,
I just wanted to tell you how people become eligible.
Oh, okay. So anybody who's 18 and older who's received at least one vaccine can enter the online drawing for the pair of the premium seats to one of several concerts. And then drawings are going to be held weekly on Thursdays in July, starting on July 8th. And winners will be contacted once their vaccination status is verified. And also, if you are one of the first 24 people to get vaccinated at the select clinics that Patrick was talking about, then you're going to get a pair of tickets to one of the concerts.
So we're talking about the first 24?
Right.
At any of these clinics?
At the select clinics that are going to be announced, will get a free pair of tickets.
And for how many shows? For the entire season?
No, it's
Jim?
It's generally shows that appeal to 18 to 34-year-olds. So it's mostly our country shows that are either here at the Hartford Healthcare Amphitheater or up at Xfinity in Hartford, or they are hip-hop shows, which is generally an 18 to 34 audience. Again, up at the Hartford Healthcare Amphitheater or up at Xfinity. They're select shows. They will be listed on the site. I'm old, as you can see. As I said, I can tell you who Jethro Tull is, but I can't tell you who Lil Durk is. So, but Lil Durk is available. They've actually donated tickets to this. All these artists have agreed to donate tickets to this program. So it's not only, it was thought up by the state of Connecticut. It was a wonderful idea. My staff and I went to the artists, and all these artists agreed to participate in it and donate tickets to the program.
The same number of tickets for each show, depending on the artist?
It's different numbers for different shows, but there's quite a few. And the state of Connecticut invested money in it also. I want to make that clear, too.
And so there are two concert venues. One is the Xfinity Theater in Hartford, and the shows there are Luke Bryan, Thomas Rhett, Lil Baby, Jonas Brothers, Florida Georgia Line, and then there's 3 shows at this theater in Bridgeport: Brothers Osborne, Trippie Redd, and Rod Wave. And I can get you more details about what those are.
Can we talk about, maybe Dr. Velazas or the Commissioner, talk about why the number 41% is significant that we need to reach?
So what we do every day with our staff is we calculate how many people have been vaccinated by each age group. The overall percentage that you're seeing at 67 to 70%, but when you look at the 18 to 34, that percentage, we've only been able to get around 41% of that population. We need to get that number over 70, 80%. So the significance here is trying to get to herd immunity.
Is there a fear that we won't reach those numbers, and how will the kind of state react to that?
We are not fearful. we will reach those numbers because we're going to put the effort into it. And like everything else, if we see that there are changes being made, the governor's team goes into action to make sure that we protect all the citizenry. So basically, everything that we do will lead to that. We have been successful so far, and we see no reason why we won't be. The reason why we're so sure is that everybody collectively have the same goals about getting these shots in the arm. And the Department of Public Health will continue to stay on point and stay on focus to work with it. Thank you.
Can you talk a little bit about what else is being done beyond Rock the Shot to reach this demographic?
So there's an ongoing team of young individuals that are working on different programs that we'll be unveiling as the summer goes through. We're just starting with Rock the Shot, but as Pat Sharmell mentioned before, we are going to do a combined amount of different activities, different reach out, reaching that community and making sure the same way we did with the older community.
And if I could just add to what the Deputy Commissioner is saying. So we were just in Waterbury earlier this week because the state has given out a number of grants. Waterbury got a $2.7 million grant to open in a shopping center in Waterbury that is very highly traveled, a vaccination clinic that people can just walk into. So there are towns and cities across the state that got those grants, and they are making accessible vaccination venues for what makes sense in their community to target underserved populations and young people.
Just mention as well, almost all of the clinics that we're operating right now have some form of incentive. So whether it's at Long Wharf, where we're giving out a $15 food voucher for those that get vaccinated can enjoy the food in the food trucks, and we'll also have hundreds of quasi-amusement park certificates that we're giving out to individuals, and the state has supported that effort. In fact, it's 500 quasi-passes for an individual that gets vaccinated. So today's incentive is added to those. And we're, as DC Aaron mentioned, actually trying to come up with other incentives and other ways, as I said, to communicate with that target population.
Dr. Velazas, would you mind talking about this Delta variant? And now I understand there's a Delta Plus, and just how, I know it's highly, it's something that is of great concern. Can you just talk a little bit more, its origin, India, and how it got here, and how dangerous it is?
So, when looking at all the variants, and I don't like the way that we talk about them from different countries, but the viruses are doing, like I said, what viruses do, which is they mutate. And sometimes they'll mutate and not be as effective, and sometimes they'll mutate and they'll be more contagious. The concern always is that you're going to get a virus that's more contagious and a virus that's going to get people sicker. Thankfully right now, our vaccines are protecting us against the Delta variant. But like we saw when the pandemic started, areas of high density populations where you had multiple generations living in one house, that virus went there and it spread quickly. And we had multiple family members coming to the hospital who were sick. Right now we've had so many people vaccinated, but there's only these smaller pockets. And without the Delta variant, we would definitely be in a better place. But the concern is now that people are going to spread the virus. It's going to be easier to catch the virus and to spread it. And again, some of these younger populations have very few symptoms. And how many people have I seen over the last few months who said, I thought it was my allergies, it was the pollen, but no, actually it was COVID. And so you have that false sense of security. You're young and you're healthy, and you think it's not anything serious. But who are you giving it to? Who are you spreading it to? So what we want to do is get people vaccinated so that the virus cannot mutate any further. It's got nowhere to live, and it dies out.
Have we had any cases of the Delta variant in Connecticut?
So the Delta variant is now becoming the major form of the virus. So the Delta variant is here. But again, right now in the hospitals, I can tell you over the last several weeks at St. Vincent's, we don't have anyone admitted to the hospital right now with COVID. And that's really a beautiful thing. At the height of this, we had 150 inpatients. When we are seeing people who are coming in with the virus, it's primarily people who are not fully vaccinated. And again, it's younger people. You'll get some older people who chose not to get vaccinated and will get sick and can get quite sick, but you're seeing that younger population, the one that we're targeting, who's coming in with those symptoms. Now, very often they don't need to be admitted, but some of them are getting quite sick and do need to stay. So we want to stop this now.
And doctor, if I'm not mistaken, the vaccination makes COVID less serious if they do get it. So it's not just that it protects them from the virus, it also makes a case less serious. Is that correct?
Absolutely. I mean, people who are vaccinated, if they do catch the virus, the symptoms tend to be very mild. And also, you don't spread it as easily because you're just not replicating as much virus in your body.
Thank you.
Commissioner Aaron, can you talk about how the state colleges mandating vaccines for their returning students, how that's going to help you reach your goal towards herd immunity?
Well, the term mandate is not one that we use. But again, anything that the schools can do regarding getting the students vaccinated will go a very long way, absolutely.
All right, thanks everybody so much for coming. We really appreciate it.
Lieutenant Governor.
Yes.
Governor,
Yes, ma'am.
I have one request with the target audience in mind, so we can all get 5 seconds for our social media platforms. Can we get everybody to scoot in for